Get into our senior years, we become more forgetful and wonder if it's a sign of old age or perhaps something else.
Dr. Allison Hennigan with the East Texas Medical Center Neurological Institute is here to tell us more. Nice to have you here, by the way.
Welcome.
Take notes,
nice
okay?
Take notes, yes.
First of all, we jokingly use the phrase dementia. What is dementia, first of all?
Dementia is a difficulty with one of several different cognitive domains. So most commonly, it's a difficulty with memory, but it is a difficulty that affects your life. If it is not affecting your work or activities of daily living, then it's not considered dementia. It's more in the realm of mild cognitive impairment.
Okay, well, what are some of the first signs of dementia that we see?
Depends on the type of dementia, but for the most common type of dementia, Alzheimer's, it's forgetting things, forgetting where you've placed things, forgetting people's names, and that tends to progress over several months to years.
Is Alzheimer's a dementia?
Dementia
is Alzheimer's, I guess?
Dementia is the broader category, and Alzheimer's is a type of dementia. There are several others, but Alzheimer's is the most common type of dementia.
If one is having dementia, would that necessarily lead to Alzheimer's on down the road?
Well, dementia, a diagnosis of dementia is most likely a diagnosis of either Alzheimer's or a different type of dementia like frontotemporal dementia. But if you have frontotemporal dementia, it doesn't necessarily lead to Alzheimer's down the road. It's a different disease state.
And there are some conditions out there that do mimic dementia, and the person actually doesn't have dementia.
Correct. Depression is one that many people overlook. Thyroid disorders, vitamin deficiencies, sometimes even seizures can mimic a dementing type of an illness.
Well, you mentioned sleep deprivation can lead to forgetting all sorts of things.
Sleep apnea is a very common one, especially in East Texas, that people don't necessarily know about.
Yeah. What about the age variance? When do you start to think that it's dementia, or if someone's too young, maybe something else?
It depends on the type of dementia, but for anybody who's less than 55, I start to look really hard at whether or not there's something else going on. But anyone who's under 65 makes Alzheimer's dementia a little bit less likely.
What if we know someone, or you live with someone, your partner, your mother, your father, they're forgetting a few things? What's the best course of action?
Best course of action is to first talk to your primary care and say, listen, I'm worried about this. And they can start and order some of the testing. But other testing, being evaluated by a neurologist, being evaluated with neuropsychological testing, all of these things can be helpful as far as trying to figure out what is going on and if there's something besides dementia that is a treatable illness.
Yeah, now, you know, I hear that if you're having to take care of someone, perhaps maybe a parent who has Alzheimer's or dementia, it can take years off their own life because it's just so stressful. Caregivers, God bless you for what you do.
Absolutely.
What are some of the resources available for caregivers?
The Alzheimer's Alliance of Smith County is a huge resource for caregivers. They are very helpful as far as trying to set up respite care. Alzheimer's, the Alzheimer's Association is also helpful, although not as much for the local areas. There's also caregivers.org for many different disorders and diseases. They can give you some tips and tricks, and the other resource, 36-Hour Day, is a book that is extremely helpful for caregivers of people with dementia specifically.
You mentioned sleep apnea and how it may play a role. I mean, there are, I know a lot of friends of mine use the machines, those CPAP machines, or the breathing machines. Can that really contribute to dementia?
It can contribute to a dementia-like state. It can contribute to memory difficulties, and if you treat the sleep apnea, the memory difficulties get better. Now, you can have sleep apnea and dementia, but it certainly treat everything that you can.
Yeah. Okay, Doctor, where can we